March is Kidney Month and March 11 is World Kidney Day. Now the 2021 theme is Kidney Health for Everyone, Everywhere, Living Well with Kidney Disease. We are very happy to have two sides of the equation in the sense that we are joined by Patricia Quamie, kidney recipient and member of the Kidney Recipient Support Group of Trinidad and Tobago. We also have Dr. Shaun Lynch. He is a nephrologist at the National Organ Transplant Unit. We want to thank you so much for joining us. And in terms of starting off, though, I think we want to start off with Patricia, please. In terms of the theme for 2021, Living Well with Kidney Disease, what are some of the things that you're trying to address under this theme, Patricia?
Okay, well, this year we want to encourage persons to stay healthy. Keep, if your pressure is like high, if you have pressure problems, keep it low. If your diabetes is high, try and keep it under control, and stay healthy, so that you will not end up with end-stage renal failure that like we have had.
Okay, and I'll bring the doctor in to actually speak to some of these things. So in terms of staying healthy, how are we doing some of those things, Dr. Lynch? And I center that around some of the discussions that you may be hearing about kidney disease in Trinidad and Tobago.
Well, just now, hold on. Sorry, my son was there. Most of the cases of chronic kidney disease are secondary to chronic diseases, diabetes, high blood pressure, mainly. So really we have to address the management that. If we address the management of those conditions, just by managing those two conditions, we can significantly reduce the incidence of chronic kidney disease and more so end-stage kidney disease. And that's really a primary healthcare issue. And as I keep saying all the time, kidney disease is by and large a symptomless disease. There are no symptoms most times. So when you have a symptomless disease, the only way you can pick it up at an early stage is really through screening. And that's where we have to improve things, where we need to screen people who are at risk for chronic kidney disease, notably, as I said, people with hypertension, people with diabetes, people who've had a family history. Someone in your family has had chronic kidney disease, definitely you should be screened. People over the age of 50, obese, those sorts of patients. And I think once we ramp up a screening process where we're able to identify the disease at an earlier stage, then it allows us a platform to intervene to try and reduce the incidence of progression.
Now, what is some of the feedback that you get? And I'll ask you the same question, Patricia. What is the same question that you get, Dr. Lynch, about saying you said it's symptomless? So
yes,
in terms, well, for the most part, before you actually say, okay, well, this is what it is, what causes people to come in? Are there things that they're looking at and saying, okay, well, yes, I have this history, so I should be checking myself? Or do you find many people like that? Or is that when they come in for screening, it is already at a level that you need to treat with it a certain way?
So absolutely brilliant question. So there are actually some people who just turn up with end-stage kidney disease. And that's an unfortunate thing. And up to about 15 to 20% of people, that happens. They actually have no history really of anything, and they turn up with end-stage kidney disease. And how we fight against that will be pretty difficult. But the rest are people who are at risk, be it that they have a family history, they have hypertension, something. And as I said, that has to start at the primary care level. There's no symptoms. Some people may develop swelling of their feet, which we call edema. But by and large, besides that, you don't develop symptoms until probably later on when you're down to about 20, 15% kidney function. And the first major symptom is a bit of fatigue. And what do people do when they feel a bit tired or they feel fatigued? They kind of try to ascribe it to other reasons. They're under some stress and that sort of thing, so they largely ignore it. So really where the intervention has to take place is at the very early stage in the primary care level. A lot of times by the time they are sent to us, they're advanced. We seldom get referrals with people with early sort of CKD that we could intervene on and try to make things better. A lot of times, most times by the time patients are referred to us, the horse has already bolted. They either advanced or on their way to becoming that. And that's a real problem.
And one of the reasons that I said I'm happy to have both you, Dr. Lynch and Ms. Quamie, is to be able to get that discussion from both sides. So listening to what Dr. Lynch just said, what is your experience in terms of like, how did you get screened, Ms. Quamie? How did you say, okay, well, I'm going to get this tested or checked?
Okay, well, in my case, I was pretty young. I was 31 years actually. And, well, I knew my family, I had a family history of hypertension. And when I never really had like headaches. All I knew my pressure would be high, but I never had headaches. Until one weekend, I had this throbbing. My headache was like a throb. And when I went to the hospital, I got a injection to calm the headache. It calmed. And 2 days after, the throb that was like this throb became this throb. And so my relative took me to a private doctor. And on doing tests, eventually as well, I was also bringing up everything I ate. Everything I ate, it will come up almost the same way as it cooked. Unchewed, everything. I would just bring up everything. And I lost weight like overnight. Overnight, I lost weight because nothing was staying in my stomach. I was just getting this headache. And on doing tests, this is when we found out. Now, that was a number of years ago. We did not even had a nephrologist in Port of Spain Hospital. So everything I had to do was privately. Fortunately, now we do have nephrologists in Trinidad and a lot of kidney specialists around, you know. But there was I had no clue that my kidney had reached end stage until when I did see the specialist. And I lost so much weight. I was so skinny and tired and weak that when he told me that I have to start going to live by this machine doing a dialysis to me, I was like stupefied. I couldn't comprehend what he was actually saying. Fortunately, my brother, who ended up being my donor, was with me to the specialist. And he was the one asking questions, what could be done and the various other things. But generally, I had no symptoms. I had no clue. No clue whatsoever. It was really something else to deal with. As a young parent, I had 3 little ones taken care of and a business running. So it was really, really, really hard to accept. And that's the other thing, that when you hear that your kidney failed, it's difficult to accept this is what is happening to you. And I think this is what makes your healthy living a little worse, because unless you accept it, then you would listen when the doctor said, do X, do Y, do Z, follow. But if you don't accept, you tend to try everything people tell you to do, and what people tell you to do 99 out of 100% of the times are the wrong things. They tell you drink coconut water, do this, do that, and that when you're on end stage, they're sending you to die quickly. Coconut water, the potassium in it is too high, and that is going to kill you quickly. You know, so this is when you have to listen to when the doctor say do X, do Y, do Z, you do it, because that is your only chance to survive.
And in terms of that conversation, and I want to throw it back to Dr. Lynch, but we do so after the break. We are speaking with Patricia Quamie as well as Dr. Shaun Lynch, and March 11 is World Kidney Day. We continue the discussion when we return. Stay with us. Welcome back. We are discussing the events or factors around World Kidney Day, with the theme this year being kidney health for everyone and everywhere, living well with kidney disease. Now, Dr. Lynch, you would have just heard Ms. Quamie recounting some of her experiences. Is this something that you find is kind of consistent with other individuals?
So you know, I'm a really passionate guy about these things, and I hear these stories and I sort of get angry. And let me tell you why I get angry. Oftentimes, hypertension is not really the root cause of kidney disease, but when you have kidney disease, hypertension is a symptom. There are so many patients who turn up to their physicians and their blood pressure is high, and they say, okay, you're hypertensive, take these medications, bye. Every single person with hypertension needs to be screened for kidney disease. And when I mean screen, there are two ways to be screened. And I really hope that if this touches one person, it has done a lot. There's a blood test called as creatinine, and there's also, you must check the urine, particularly for blood and protein. Now, here's why. Many physicians will do the blood test, and the blood test will be normal or close to normal. But if you have a normal or close to normal blood test, and you have a lot of protein in the urine, it is only a matter of time before that kidney function starts to deteriorate. And therefore, you would miss the opportunity to try and intervene and to stop that process from happening, or to diagnose what's the cause of that process. And this is what happens years later when these things are ignored or not done. The patient turns up feeling very ill, vomiting, feeling out of their skin, losing weight, and they turn up with a creatinine of 15 and 20, which is really bad because the normal number is about 1. And I have to have a discussion with them like, your kidneys are gone, you need to start dialysis. And the first thing they ask is, what is dialysis? They've had no prior exposure to this, and it is like a bomb going off. And I see it all the time, and you see it in their face, and you see that they are just lost. Their world has just exploded for something that potentially could have been sorted out early on, or even if, sometimes even when we pick up something, we're not able to stop it, but at least we can prepare the patient for either one, getting a kidney transplant, so you could actually get a kidney transplant before you get to dialysis, or preparing them for dialysis. They need some education, they have to prepare mentally, physically, financially, emotionally. But when they turn up in the emergency room, and my talk to them is that you need dialysis, and they say when, and I say like in the next 20 minutes, where's the chance to do that? And this is a very common Trinidadian story, which I've been trying to change in all my talks with primary care physicians and stuff, but it seems to not be getting any better.
And some of those factors, we want to get into some of the factors about transplantation. But before that, I want to ask you, Miss Patricia, how important was it to have your brother there? Yes, he was your donor, but even before that, you said when, and to use Dr. Lynch's words, when this bomb went off in your head, your brother was the one asking the questions and getting that information and basically being there by your side. How important was that support?
Well, that was very important, because if it was me alone, I don't know what would happen, what would have happened, because I was literally in a trance, as Dr. Lynch said. I was in a trance. I can remember hearing my brother talking on the background, but I was in a trance because I was like, today I'm normal with a headache, and tomorrow you're telling me I have to live unless I use this machine. I will not be able to live properly. I did not even know what dialysis was. I was spelling the word dialysis. I could not say dialysis. It's because I had to undergo it, and then I made up my mind to learn what it was all about. And of course, my brother assisted in many ways. He has been my rock from ever since.
And with that, I want to get to the...
And I know of other persons. I'm sorry?
No problem. And with that, I want to get to the role of the Kidney Recipient Support Group of Trinidad and Tobago, please, because you're a member. So what is the group there to do, and how does it operate or function?
Okay, well, we have started in 2011, okay? The group has started in 2011, and we are made up of persons who have been recipients of kidneys. We are also people who have been donors of kidneys, and also anyone who wants to support, anyone who show an interest and want to be a part of the group, they can become a part of the group. Now, what we do is we do awareness we work along with the National Organ Transplant Unit, who are located at the Eric Williams Medical Complex in Mount Hope. And we work along with them, and we do things like outreach. We go to schools, we go to the malls, different places, and try to encourage persons on end-stage renal failure, which means if they know that they are diabetic or hypertension, try and see how they can control that, because this is what leads to end-stage renal failure. If they have that under control, then we will not have as much persons in the country or in the world with end-stage renal failure. So basically, the group, what we do, we are an NGO. We don't really, we are a non-monetary NGO, right? We don't make money, but what we do is we go around and we spread, telling other persons about kidney. Some people, first time they will hear about kidney situations. You know, we educate people as much as we can, tell them our story of how we came like this, so they will know if they have a problem with diabetes or hypertension, get a check before they end up like us. Today, I'm looking fine. When I had kidney failure, because I got a transplant, this year I'll make it 15 years. September will make it 15 years. However, before I did the transplant, on this frame of mine, height, I'm a very tall person, and I was weighing 112 pounds, sometimes 106 pounds. Yes, that bad. You know, I was looking really horrible, a mess. And because of what I have gone through, and persons who knew me and saw me back then, saw me through the dialysis times and even now after transplant, some persons, every time they see me, will say things like, you could tell me you don't have a God, because it only take a God to bring a person from where you were to where you are now, right? I'm saying that so you can get a visualize, you know, have a little idea of what it is. And for persons who are listening to this program or watching this program, can pay heed if they know that they are diabetic or their pressure is high. They have it in their family. My both parents were hypertensive. They both died of hypertension. And it's years after they died, I came down with this problem. And with that, fortunately, everyone else in the family, including my kids, are grown now, and they are all paying attention to these things. You know, the slightest sign, they check to make sure that their pressure is under control, so they don't have to reach end-stage kidney failure, because we are all educated in my family now. So I'm saying this so people can see how serious it is. We thought it was, you know, ordinary. And we want to thank you so much for actually raising that clarion call, talking about both types of screening, Dr. Lynch, talking about the fact that symptoms are not necessarily there to be had, giving us information, Ms. Patricia, from your personal experience, which is sometimes not the easiest thing to do, to recount those kind of experiences. But we want to thank you for the work that you're doing. And on behalf of the entire news team, we want to thank you for joining us this evening. I'm DK Roster. Have a good night.